I'm here with Dr. Ed Walsh, professor of medicine at the University of Rochester Medical Center, and Dr. Betsy McCoy, the founder of the Committee to Reduce Infection Deaths. Thanks for joining us. Dr. Walsh, as far as infection goes, what does a hospital look like?
Well, a hospital today is a much different place than it was 15 or 20 years ago.
In what way?
In many ways. We have many more patients coming through. We have more crowded emergency rooms. We have shorter hospitalizations with more intensive care being given. And I think most importantly, we actually have a very different patient population. Much of our care is outpatient now. It's when they come into the hospital, they're more acutely ill.
But what does that mean to the sterility of the place, the bacterial environment in the place?
Well, one of the problems, of course, is that as we have more crowded facilities and have more crowded populations in using these facilities, we have the introduction of various organisms into the hospital, various viruses, various bacteria, and so forth.
So you make it sound as if it's a seething cauldron of disease.
Well, you might consider it a seething cauldron of potential disease.
Well, Dr. McCoy, your special interest is hospital-acquired infections. It doesn't sound like it's a very cheery introduction here.
Well, actually, it could be very cheery because the good news is that research shows at least 90% of these infections are preventable. And you don't often come across such a big problem that you can solve. And that's why I founded the Committee to Reduce Infection Deaths, because proper hygiene, rigorous procedures, rigorous cleaning in hospitals can solve many of these problems and save many lives.
You're talking about infections acquired inside the hospital.
That's right.
What do you do to decrease the rates of hospital-acquired infections, some of which can be deadly?
The most important thing is to make hospitals cleaner and to improve hygiene practices within the hospital. These dangerous drug-resistant bacteria get to the patient on unclean hands, inadequately cleaned equipment, and improperly cleaned patients' rooms and operating rooms. Dr.
Walsh, is it fair to characterize hospitals as simply doing a bad job of cleaning up and almost by inattention infecting their patients?
In some instances it clearly is. And unfortunately it's a very complex situation because not only do we have thousands of healthcare workers within the hospital and hundreds of patients, but we have literally on a daily basis thousands of visitors.
And they're all carrying stuff in from the outside?
Well, everyone is carrying bacteria and viruses at various times, sometimes asymptomatically, and it makes it very difficult.
This is hard. You can't see the bugs, right?
But until recently, there was an assumption that infection is the inevitable risk you face when you go into the hospital. Here's the irony. In almost every part of the United States, restaurants are inspected for cleanliness, but not hospitals, not even operating rooms. You can go home and make your own dinner.
But
when you have to go to a hospital, you should be able to expect a clean facility. Until 1970, hospitals regularly tested the surfaces for bacterial content. In 1970, the Centers for Disease Control and Prevention and the American Hospital Association literally announced that hospitals should no longer be expending resources testing for bacterial contamination. But the fact is, since that time, MRSA, for example, one of the deadly superbugs, has increased 32-fold. And there is compelling evidence linking poor cleaning in hospitals to high infection rates.